Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
Okay, let's unpack this. Today, we're taking a deep dive into an absolutely critical and, rapidly evolving area for mental health practitioners. Crisis management and emergency protocols in telemental health.
Yeah, it really is.
This isn't just a growing field. It's fundamentally reshaping how we provide vital care, often, in moments of extreme vulnerability.
Indeed. And it's important, we mentioned right at the top, that this deep dive was created using generative AI tools. This helps with accessibility and clarity.
Right.
But the content itself, that's all grounded in the original research, the instructional design, and the professional insights of Dr. Michael Jones.
Good to know.
So our mission today is really to help you develop a robust understanding of these specialized protocols. We're moving beyond just, what can go wrong to actually navigating the compliance, the risk, and that ethical decision-making that's just so central to delivering virtual care effectively.
That's a really crucial distinction, isn't it? We'll be looking at, everything from the evidence, which is pretty compelling.
It is.
Supporting telehealth in crisis intervention, to the ethical and legal frameworks guiding our responses, and even how technology is kind of changing the game.
Absolutely.
So get ready to understand not just the what, but really the why it matters and maybe the how you can apply this directly in your practice.
Sounds good.
So to kick us off, let's make sure we're all operating with a shared understanding. When we talk about crisis management in a virtual setting, what are the core concepts, the basics we need to grasp?
Yeah, great place to start. So first you've got crisis intervention. That's that immediate therapeutic response, right?
Yeah.
To acute psychological distress.
Okay.
In telehealth, this puts a huge emphasis on rapid remote assessment.
Makes sense.
Then there are emergency procedures. These are your actual written protocols. They outline the specific steps you'll take during a client crisis in telemental health.
The playbook, essentially.
Exactly. And professional standards, like from CACREP, they specifically require these for supervision agreements, which just shows how important they are, even if you're in independent practice.
Right.
And finally, there's remote crisis assessment. So that's the actual process of evaluating suicide risk, imminent danger, using telecommunications tech.
And that requires different skills.
It really does.
Yeah.
Specialized competencies, and often protocols that are, thoughtfully modified compared to doing it in person. What's fascinating, I think, is how these established terms just take on new layers of complexity and actually new opportunities, too, when you shift from that traditional face-to-face setting to a virtual one.
That nuance is definitely key. And speaking of new opportunities, or maybe just effectiveness, when we look at the data, what are some of the findings? Are there surprising results about telehealth's effectiveness in crisis management, especially, say, around suicide risk?
Oh, it's quite compelling, actually. There was a systematic review and meta-analysis looking at telepsychiatry interventions, or TPIs.
Okay.
And it found they significantly reduced suicide rates and reattempts. The odds ratio was 0.68, which is a pretty substantial protective effect. It means clients getting these interventions are significantly less likely to attempt or reattempt suicide.
That's huge.
Yeah. And we see this echoed in real-world data, too, like from the Department of Veterans Affairs, the VA.
Right, a big system.
Huge. Their data shows that just a 1% increase in virtual mental health visits correlates with a 2.5% decrease in suicide-related events.
That's a powerful correlation.
It is. And the VA has even shown they can achieve basically functional equivalence to face-to-face treatment in suicide risk assessment. And that's despite facing some pretty significant legal and logistical hurdles setting up those specialized protocols.
That's incredible progress. And it brings up a point about specific groups. Does telehealth have a particular impact or benefit for populations that might be, say, traditionally underserved?
Ah, yes.
Yeah.
That's where telehealth can really make a difference.
Yeah.
Crisis management via telehealth is particularly crucial for rural and underserved populations. The data shows something like 40% of clients seeking telemental health services in rural areas report having recent thoughts of suicide.
40%. That's high.
It is. But here's what's really significant and maybe challenges some assumptions.
Mm-hmm.
Demographic variables, like where someone lives, their gender, race, ethnicity, they do not significantly predict suicide ideation rates in these remote populations.
Really, not location.
Nope. Instead, the strongest clinical predictor, it's depression,
Ah, okay.
which really underscores how critical strong clinical assessment skills are over just relying on demographic assumptions when you're doing a remote evaluation. Your focus has to be on the client's internal state, not just their zip code.
That's a vital point for practice. So, okay, we have this promising evidence. Let's shift gears a bit to ethics. Informed consent is always foundational, right?
Always.
How does that adapt when we're talking about a potential crisis in a virtual setting?
Yeah, it's a critical ethical cornerstone. The ACA Code, for instance, makes it clear it's an obligation. You have to inform clients about your emergency procedures.
Before you even start.
Absolutely. Before services begin, you need to talk about the inherent limitations of remote intervention, what local emergency resources are available to them.
Okay.
And this isn't just a quick mention. It needs to be a real discussion, covering things like the potential for involuntary hospitalization, how you might need to contact emergency services in their specific location.
Right, because you're not there.
Exactly.
Yeah.
And how you'd coordinate with local crisis teams. And this is vital. You also have to address technology failures in that informed consent.
Oh, yeah.
What's the backup plan? What are the communication methods if the video freezes or the call drops right in the middle of a crisis? That has to be planned for.
That makes total sense. Now, staying with ethics, but on the sensitive topic of confidentiality, how do we navigate balancing client privacy with that duty to protect when there's a risk of serious harm, but we're remote? Does the threshold itself change?
That's a great question. The fundamental threshold itself, the serious and foreseeable harm standard from the ACA Code that remains the ethical benchmark.
Okay.
That's when breaching confidentiality might be required to protect the client or someone else from significant anticipated harm. And that applies whether you're in person or virtual.
But it feels different remotely.
It does, because the application demands heightened awareness, your ability to assess imminent danger, and then coordinate an effective intervention across potentially large geographic distances. Well, it can be significantly more complex.
Right.
So as providers, we have to develop distinct competency in remote risk assessment, but also, crucially, understand the limitations of our ability to ensure immediate physical safety from afar.
Mm-hmm.
This includes having really clear protocols for when telehealth just isn't appropriate anymore and you need to transition or refer for an in-person emergency intervention. It's a constant balancing act, really, between helping and protecting.
Okay, so moving from the ethical shoulds maybe to the more practical legal realities, what about documentation and mandated reporting? How do those obligations adapt or shift in a telemental health world?
Yeah, the legal standards are absolutely paramount, and they definitely have their own set of challenges in the virtual space. Your crisis documentation in telemental health still has to meet all the usual clinical and legal standards.
Of course.
But it also has to specifically address the unique challenges of remote practice. For instance, CACREP standards, which guide training programs, really underscore the need for detailed written supervision agreements covering emergency procedures.
And that applies beyond training.
Absolutely. The principle extends right into independent practice. Your emergency protocols need to be solid, written down, and reviewed regularly.
And mandated reporting, like for child abuse.
Still fully applicable, even if your observations are through a screen. Those obligations remain. But counselors can face increased challenges, right? Documenting observable indicators might be harder remotely.
I can see that.
And coordinating with, say, child protective services across different state lines or jurisdictions adds another layer of complexity.
Ah, jurisdictions. That sounds like it could be a real minefield. What are the key pitfalls there? What do practitioners absolutely need to watch out for with different state laws?
It absolutely can be a minefield. Jurisdictional and legal complications are a major hurdle. You're dealing with complex licensing requirements that can vary wildly state to state.
Right.
And often different procedures for things like involuntary detainment across those state lines.
So you need to know the rules everywhere.
Pretty much.
Yeah.
You absolutely must understand the legal frameworks governing emergency intervention in both your own practice location and the client's physical location, because they can differ significantly, and that impacts what you can legally do to intervene.
Wow.
You know, the early days of the COVID-19 pandemic really threw this into sharp relief. Everyone had to adapt rapidly to telehealth. But it also raised serious concerns. How do you manage high-risk suicidal patients remotely versus, the ethical implications of not pushing for in-person intervention when it might be clinically necessary? It showed just how dynamic and complex this legal landscape is for virtual care.
Okay, so bearing all that complexity in mind, let's get into the how. When you're actually doing a crisis assessment remotely, what specific modifications or maybe enhanced skills are really essential to make sure it's effective?
Right. This is where modified protocols and sharpened skills are key. Doing a comprehensive suicide risk assessment via telehealth means you have to first acknowledge the limitations, right? Limited physical observation, less environmental control than in an office.
Sure.
So clinicians need to develop significantly enhanced verbal assessment skills and really rely on structured interview techniques to compensate for maybe fewer nonverbal cues or less awareness of the immediate surroundings.
And you mentioned depression earlier.
Exactly. A crucial finding, especially for telehealth populations, is that depression often emerges as the strongest predictor of suicide ideation, much more so than demographics.
Okay.
So this strongly suggests that integrating standardized depression screening tools, making them a seamless part of your crisis assessment protocol, is really important.
Makes sense.
And also just be prepared. Clinicians need to anticipate potentially high prevalence rates of suicide ideation because those demographic factors we talked about, they've proven pretty unreliable as indicators of risk in remote populations. The clinical picture is what matters most.
That's really practical advice. And beyond just the individual clinician's skill, we're seeing technology playing a bigger role. These technology-enhanced decision support tools, how do they fit in? How do they augment remote crisis assessment?
Yeah, they fit in as a potentially powerful supplement. And the research is promising. Some telehealth-supported decision-making platforms have shown significant efficacy.
How?
Well, in reducing suicidal ideation and achieving remission rates that are notably higher than control groups in some studies. So these platforms can be really invaluable in assisting clinicians, providing structured risk assessment frameworks, offering decision support right when you need it during a crisis. However, and this is a crucial caveat,
Okay.
they absolutely must supplement, not replace, clinical judgment.
Right. It's a tool, not the whole toolbox.
Precisely. And using them effectively requires specific training, both in, how to actually use the platform itself, but just as importantly, how to accurately interpret the risk assessments it generates within the broader clinical context of that specific client. You have to leverage the tool wisely.
It's clear this isn't just about individual skills then. For crisis management and telehealth to really work, what kind of robust systems, what kind of coordination needs to be in place? It sounds like it takes a village almost.
You're absolutely right. It really is about the ecosystem of care surrounding that client. There are models emerging like the hospital-school community telepartnership or HSCT model,
Okay.
which highlights just how important rapid interagency coordination is. For example, in addressing student suicidality using telehealth platforms.
So connecting different players.
Exactly. It emphasizes the critical need for pre-established relationships with emergency services, with local mental health crisis teams, medical facilities, all in the client's geographic area.
So homework for the practitioner.
Definitely. As a provider, you really need to develop comprehensive emergency contact lists. Include local crisis hotlines, emergency departments, police departments, mobile crisis units for each geographic area where you have clients.
It could be a lot of lists.
It could. And crucially, these contacts need to be verified and updated regularly, maybe even quarterly. Things change, fast phone numbers, services offered. You need current info when a crisis hits.
That's a really important operational point. So building on that ecosystem idea, how do the actual crisis intervention protocols themselves need to be adapted? Specifically for remote settings, especially thinking about those tech failures we mentioned.
Yeah, they absolutely need adaptation, even though the core principles of good crisis intervention remain the same. We've seen, for instance, how school-based telehealth interventions using things like CBT have been effective for youth suicidality.
So the therapies can translate.
They can. It shows that structured, protocol-driven approaches can maintain effectiveness even when delivered remotely. The key adaptation, though, is that these protocols must include specific steps for technology failure scenarios.
Plan B, Plan C.
Exactly. Clearly defined backup communication methods, clear procedures for coordinating with local emergency responders if, heaven forbid, you lose direct contact with the client.
Right.
You absolutely have to think through those what-if scenarios. What if the internet goes down? What if their phone dies? What if you lose the video feed? You need a plan B, C, and sometimes, even a D.
Given how quickly this field is evolving, all this tech, the protocols, what does ongoing professional competency really look like here for telemental health crisis management?
It means continuous learning and refinement are just non-negotiable. Seriously. Organizations like the NBCC, the National Board for Certified Counselors, they require appropriate training in crisis management and ongoing continuing education specifically for telehealth. Similarly, CACREP standards for training programs emphasize that student supervision must include emergency procedures.
Setting the foundation early.
Right. And that sets the stage for needing ongoing professional development throughout your career in this area. And rapid ethical decision-making is also just paramount in telehealth crises.
More complex remotely?
Often, yes.
Yeah.
You're balancing client autonomy, beneficence, legal obligations, but now with geographic separation limiting your options sometimes. The ACA Code talks about needing carefully considered ethical decision-making processes.
Yeah.
And that complexity is just significantly amplified in a virtual crisis situation.
So beyond the initial training and the ongoing CEs, what about quality assurance? How do we ensure we're actually doing this well and improving over time? What mechanisms are crucial?
Quality assurance and continuous improvement. Essential pillars for responsible practice here. The NBCC's crisis management competency domain actually stresses the importance of robust follow-up procedures after a crisis intervention.
Okay.
In telehealth, this follow-up needs to include systematically assessing, how effective was the emergency response itself, gauging client satisfaction with how it was handled, and critically, identifying any system improvements needed for the next time.
Learning from each incident.
Exactly.
Okay.
This might involve things like systematic follow-up studies, collecting data carefully and ethically, of course, from clients, maybe emergency responders, collaborating agencies, and perhaps most importantly, ongoing supervision and consultation remain absolutely essential for maintaining competency. The NBCC code requires counselors seek supervision or consultation when they're unsure.
Right.
And that obligation becomes even more critical in these high-stakes crisis situations where geographic separation can just naturally increase uncertainty about the best, most effective interventions. You need that support network.
Wow. What an insightful deep dive today. It's just abundantly clear, isn't it? While telemental health offers this incredible potential, especially for crisis intervention and reaching underserved folks,
Huge potential.
it also demands really specialized knowledge, meticulously clear protocols, and just an unwavering commitment to ongoing ethical and legal diligence.
Indeed. And, the ability to effectively manage crises in a virtual environment, it isn't just about compliance checklists or navigating new tech.
No.
It's truly a profound way to extend critical, potentially life-saving support to those who need it most, wherever they might be, and ultimately, to make a real tangible difference in people's lives.
A powerful way to end. Before we close, we have 2 questions for you to consider as you reflect on today's deep dive. First, how might the principles discussed today influence the way you approach your next client session, particularly if it involves remote care for a client who might be in distress? And second, what steps can you take, starting now maybe, to strengthen your personal or perhaps your organizational emergency protocols to better support clients experiencing a telemental health crisis?
Great questions to ponder.
Thank you so much for joining us for this deep dive. We really hope this has equipped you with some valuable insights for your practice. Until next time, keep learning, keep growing, and stay well informed.